Hello everyone, it's Nature and Lifestyle and I do welcome all of you to today's video. Let's quickly look at the job description or the key responsibilities of senior carers. Exactly what will you be doing as a senior carer when you go to work? I know most of you are currently going through the process of traveling to the UK to work as senior carers in hospitals and in care homes. And there are some of you who are already in the UK who are also looking forward to work as carers, senior carers, or healthcare assistants in various hospitals and in care homes as well. Exactly what will you be doing when you go to work? That is the purpose of today's video. Before I explain the job description or the key responsibilities of senior carers or healthcare assistant, let me quickly explain the difference between a senior carer and a healthcare assistant. If you work in a hospital, you are called a healthcare assistant, and if you work in a care home, you are called a carer or a senior carer. To upgrade from a carer to a senior carer, you need to do some few courses, okay? Or you need to undergo some nursing education. That is why enrolled nurses, community health nurses, and other healthcare professionals in overseas countries come directly to the UK to work as senior carers because we have gone through some nursing education. We are not just people who have no knowledge in nursing. And if you have no knowledge in nursing and you are working as a carer, to become a senior carer, you need to do some courses, okay, before you are promoted as a senior carer. In the hospital too, the starting point is a healthcare assistant. Now, the healthcare assistant, we have it in bands. We have band 1 healthcare assistant, band 2, and band 3 healthcare assistant. The band 3 healthcare assistants are equivalent to senior carers in the care home. Let's now look at the job description or the key responsibilities. The first one is promoting the patient independence. Guys, this is very important. Whether you work in a care home or in a hospital, you realize that the residents or the patients you are taking care of are still able to do some things for themselves. They are still able to do some few activities of daily living. You have to encourage them to do those very things they are still able to do for themselves. So, example, the patient is not able to mobilize well, okay? You assist the patient onto a shower chair, then onto the bathroom. When you get to the bathroom, the patient can wash his or her top half, and you give the patient a towel to dry himself. Then you go in to assist the patient to wash other areas of the body that he or she is not able to wash now. There are others too who like to make their own tea, okay? If you go to care home, there are patients who want to go to the kitchen to prepare their own tea. There are patients who just want to walk around, also help to wash some dishes, okay? You encourage them to do this. When you do this, you promote their independence. You promote they being able to do some things for themselves. So this is very important. Another key responsibility is assisting with personal care. Okay, assisting with personal care. So for patients who are not able to do anything for themselves, you assist them with personal care activities such as bathing, okay? So you wash them, you groom them, you dress them. Some of them too even need some, makeups on. You assist them with it if you are good in doing makeups, okay? So you assist the patient with their personal care. This is also another job description for you. Also, you assist with medicational support, okay? Medicational support. Now, for the medicational support, you need to do 1 or 2 courses, okay? You can't just go in and start administering medications without knowing how to do this very well. So in care homes, senior carers who are allowed to assist with medication administration, they undergo some training before they're able to do this. Even when they are allowed to give medication, they are only allowed to give oral medication and sometimes topical medication, okay? They are not allowed to give intramuscular medication or subcutaneous medication. They are also not allowed to administer controlled drugs, okay? They are not allowed to administer controlled drugs. If they want to administer controlled drugs, give IM or subcut medication, that has to be under the supervision of a registered nurse, okay? So in some care homes, senior carers are allowed to administer medication if they have the competency to do so. Another key responsibility is supervision of carers. And in some care homes, senior carers are called team leaders. And as a team leader, you have an oversight responsibility over the carers. You have to allocate where they have to work. You have to supervise their work, okay? If there's any problem, the carers will report to you, and if you are not able to handle the problem, then you report to the registered nurse. Then the registered nurse also report to someone who is a higher rank above him or her. So you, the senior carer, have an oversight responsibility or supervision over the carers who are working under you. And for newly recruited carers, they'll be handed to you, the senior carer, for training. So for about a week or two, they'll follow you. Whatever activity that you're doing, you'll be training these newly recruited carers, okay, about how to provide personal care and other activities to their patients. So as a senior carer, you have a supervisory role over the rest of the carers. Another responsibility is cleaning. Guys, this is very, very important. And this depends on individual care homes. There are some care homes that when you work with them, you have to do cleaning. That is washing utensils, washing bowls in the kitchen in the night, okay? There are some care homes that you have to do this. Other care homes, as a night carer, you have to sort out all the dirty linen that the day staff gathered. You have to sort them out and put some of them into the washing machine for it to be washed, for it to be prepared for the next day usage, okay? And there are also care homes that you have to clean the floor, you have to clean the tables, you have to clean the corridors, you have to clean the patient room, okay? Keep the patient room tidy. So there are some care homes that as a senior carer, cleaning will be your job responsibility. Another one is taking care of patients with dementia. Guys, most care homes have patients with dementia, and it is very good that you understand dementia care. That is why it is very important for you to do the health and care certificate courses I spoke about in my other video, okay? You have to do this course because we have one module of the course that is about dementia care and support. Now, most of the residents you'll be taking care of in the care home have dementia, okay? And with dementia, they have memory loss, they are confused, some of them are depressed, some of them are agitated. You have to really study your patients, know some of the things they do when they are agitated, okay? What makes them agitated? What makes them very confused, okay? If some of them, if they have infection, they have increased confusion. Some of them get agitated if they feel like moving their bowel or passing urine. So as a senior carer, dementia care support is part of your job description. Another key responsibility is assisting patients under palliative care or providing end-of-life care support. Providing end-of-life care support. Guys, this is very important because you realize that in the hospital or in the care home, there are some patients who are in their end stage of life, okay? When providing palliative care, it means that providing a care that relieves the patient's symptoms without actually treating the patient's conditions, okay? without actually treating the patient's medical condition. So you are assisting the patient to relieve his immediate signs and symptoms. Example, if your patient is vomiting and your patient is an end-of-life care, you just administer medication that will help stop the vomiting. If the patient is spiking temperature, you administer medication that will help reduce the patient temperature. If your patient is very chesty, if your patient is having loose bowel, you administer medication that will take care of these signs and symptoms without actually treating the condition that is causing this, because the patients are in end-of-life care or palliative care. Now, as a senior carer, taking care of this patient is part of your responsibility or your job role. Now, another one is also assisting patients with their social activities. Now, this is very, very important. You realize that in the care home, apart from the nursing care and the other care that we give to patients, patients also undergo some social activities. Now, example of those social activities are the patient going out for shopping. Okay, so some of them will go out for shopping, some of them will go out for sightseeing. You have to accompany them. It's all part of their social activities. Some of them too, when they are in the care home, they play some games such as Ludo. Some of them play cards. Okay, some of them also paint. Some of them like drawing. Some of them like to go to the garden to just water the flowers. These are all social activities that you have to assist your resident with. It's also part of the job description of a senior carer. Then you also assist the patient with their appointment. Most of the patients will have to go to their GP surgery. They have to go to hospitals for appointments. It is also part of a job description to assist this patient, to accompany them to these places to attend their appointment. Some of them are even used to some carers or senior carers, okay? So they feel comfortable when you accompany them, other than some person that they don't know to what accompany them. Okay, so you assisting or accompanying patient for an appointment with their GP or at the hospital is part of your job description. Another important job description is assisting patients with repositioning and continence care. Guys, this is very important. You realize that some of your patients or residents have lost their continence. They are not able to detect whether they are moving their bowel or they are passing urine. Okay, so you check them from time to time. I know in some care homes you check them every 3 hours, every 2 hours, or every 4 hours. Okay, you just check if they've moved their bowel or if they've passed urine. You just change their pad and you clean them. Make sure they are well clean, then you put a new pad on them. That is continence care. Now, another one is some of the patients have not totally lost their continence. They just need prompting. So you just prompt them to the toilet, you assist them onto the toilet, and they move their bowel or they pass urine. With regards to the repositioning, some of the patients or residents are bedridden, okay? They are not able to move their body from side to side, or they are not able to change their sleeping position. So you have to assist them with changing their sleeping position, which is called repositioning. This is very important. Now, another job description is meal preparation, which is very, very important. And you assist with meal preparation in several ways. The first one is even preparing the next day's menu, okay? Preparing the next day's menu is very important. So you ask the patient or your resident what they will eat the next day. You note it down and you give it to the kitchen staff to prepare the meal, okay? Then you also have to take note the consistency of the food that the patient eats. Some of them are on normal fluid and normal diet. That is, they can eat everything, okay? Some of them are on soft diet. Some of them are on puree or minced diet, okay? Some of them, their fluid need to be thickened. Now, all these are part of meal preparation. And yes, you undergo training with this as well. You undergo some level of training with this. So it's also part of job description. Again, with the meal preparation, usually the food is prepared in the kitchen by the kitchen staff. They will bring the food to the ward. Now, when they bring it to the ward, it is your responsibility to assist in distributing the food to the patient or the resident. Then, for those who are not able to feed themselves, you assist them with feeding as well, okay? You assist them with feeding. So, you assist with meal preparation. That is one of your job description as a senior carer or a healthcare assistant. Now, another job description is completing care plans. Completing care plans. Guys, this is also very important job role as a senior carer. Now, there are a lot of care plans in the ward and in the nursing home as well. We have care plans about continence care. We have care plans about the patient feeding, okay? Now, the care plan to complete all depends on the specific hospital or the care home that you are going to work with. But just bear in mind that you'll be along the way be completing some care plans for some of the patients or residents. Now, I've brought into conclusion the job description of a senior carer or a healthcare assistant. Let me add that all these things that I've said depends on the hospital or the care home you're working with, okay? Every hospital and care home has a different way of doing things. So it all depends on the hospital or the care home you are working with. But on the average, these are some of the things you'll be doing when you go to work as a senior carer or a healthcare assistant. My name is Mordecai. It's Nature and Lifestyle. Thank you very much for watching today's video. Again, if you have any question at all, please ask me in this video comment section. Please share this video, like this video, and most importantly, leave your comment in the comment section and also subscribe. Hit the subscribe button if you haven't done so. See you with another video another time.